Episode: Look Up First. A patient's comment that a skilled student never made her feel seen sends the skeptical educator hunting for a way to teach empathy, until the committee helps him see that demonstrating empathy is a far horizon, integrated achievement he cannot demand of 8-week beginners. Together, they scaffold it down to the first affective rung, receiving and write an observable objective his first-day students can actually meet. Before any task, verify who the patient is, then ask what matters to her that day. The last night of the first clinical rotation. 12 students, every skill signed off. Then the skeptical educator reads the one line he cannot put down.
She was quick, she was careful, I just never felt like she saw me. There has to be a way to teach this. Give me a checklist, something I can actually grade.
I can. Have them say I understand, hold eye contact, name the feeling back. A repeatable script.
A script cannot teach a scared beginner to notice the person in front of them.
Time to reflect. When a learner is efficient but a patient feels unseen, what did our objectives forget to ask for?
The next morning, Domain 2, Person-Centered Care, on the table. Today's line: demonstrate qualities of empathy.
Demonstrate empathy? They are 8 weeks in. Half are still scared of the pump. You cannot grade a feeling.
Demonstrating empathy sits at the far end of the ladder. It is a whole way of being with people, and it takes time. We cannot ask that of someone in their first week.
So we start at the bottom rung, receiving. Before they can show it, they have to notice the person is even there.
Time to reflect. Which of your affective objectives name the finish line when your learners are still standing at the first rung?
Notice. Hand them a script and I'm back to the machine's checklist. And writing that a student notices is not something I can observe anyway.
So make it something they do. Before any task, ask her name to be sure it is her, then ask what matters to her today.
You are not grading whether they felt it. You watch whether they asked, and you let them tell you the one thing their patient cared about.
Time to reflect. How do you gather evidence that a student attended to a person without grading the feeling itself?
It goes into his practicum syllabus. On the committee chart, the person-centered care row is no longer blank.
Read it the way a first-day student will. Before you touch the pump, look at her and ask what matters to her today. That feels doable, even on a first day. I could not teach them to feel it, but I could teach them to look up. Next rotation, I can ask them what they noticed.